So for this skill, we're going to DC our IV fluids going to our brown port and lock it off. So what we're going to do is we make sure we identify that it's the right patient and that we have a physician order for this. As well, let's stop this infusion and put that on standby. Now when we open up our line, let's make sure that our clamp is locked, and we'll disconnect our tubing. We can put a cap on the end of our infusion, just in case we decide to use it later, and put it to the side. Because I've put my port down, I'm going to want to make sure I swab with an alcohol swab for about 30 seconds using friction. Now because the infusion that was going to this line was just a normal saline or D5.5, kind of a regular IV infusion, we don't have to worry about taking a discard. If it was an infusion that was running, say, heparin or insulin, we wouldn't want to bolus or push that medication that's still in our IV to the patient. So we would take a discard in that situation. However, I'm going to grab my normal saline flush and make sure that I have all the bubbles out and attach that flush. I'm going to unclamp my tubing. Sometimes you will see nurses pull back a little bit on their flush just so that they see the blood return. Okay. And then they'll flush that line. You could use a push pause to kind of clean the line. Okay, and when we take the syringe off, we're going to clamp that again. Now because this is a non-valved line, we're going to heparinize it. So we're going to put heparin in the line, and of course check with your facility. So I have actually too much heparin here. So I got 500 units. I don't need 500 units. Usually it's a 200 units for locking central lines. But of course, check with your policy and procedure. So I would just put that into med waste. Okay. And I would make sure I have exactly 2 mLs, which is 200 units, because it's 100 units per ml. Now I'm still holding my line, so I don't need to swab. However, if I had put it back down, I would need to re-swab, make sure it's clean. So I'm going to attach my heparin. I've checked my facility policy, and that should be written in the MAR as well. Okay, I'm going to instill that 200 units of heparin. When I get down to the last 0.5, I'm going to have the clamp in my hand, and I'm going to apply some positive pressure. So I'm going to push down still with the syringe, and then at the same time clamp. And our hope is that we're trying to trap in some pressure in this line to keep that line open so it doesn't clot, so blood doesn't back up into the line. Okay, and so there we go. All my other lumens are clamped as well. It's a good double check, and they all have caps on them. So now I would just go to my MAR, and I would document that I gave heparin 200 units for line installation.